first time I ever had to take my son to any type of crisis unit was right after a suicide attempt when he was 15. We arrived at the hospital around 3:30 in the afternoon. My son was finally seen by a provider after we'd been waiting for about 18 hours. Taking my son to an emergency room on a Friday night, knowing that he's experiencing mental health issues, was extremely stressful. The unbearable wait time caused even more stress on him, caused stress on my husband and myself. When we finally did speak with the social worker, he was in a very different mental state 18 hours later than he was when we walked in the door. So while some of our concerns were addressed, I still had a lot of fear surrounding him taking his life and where he was mentally. We did not know what to expect, but we did not expect to have to wait that long with a child who attempted to take their own life. There's no need to wait 18 hours for somebody when we have technology.
Telepsychiatry could have dramatically improved Annie's experience. Seeing patients rapidly through telepsychiatry can reduce the uncertainty that patients are feeling, help them to move to the next level of care much more quickly, and thereby reduce both the risk of their aggression and bad outcomes. Telepsychiatry can really help with the pediatric psychiatric crisis in the United States by bringing a board-certified child psychiatrist to really any emergency room, seeing that person rapidly, efficiently, and providing a really solid treatment plan for that individual. There's really no patient that cannot be seen through telepsychiatry.
Another time that I went to crisis, it was a vastly different experience. And I mean that in an extremely positive way. The hospital this time around now had the capability for us to be seen virtually. We were seen by a psychiatrist within 3 hours.
The process of doing telepsychiatry is actually similar to that for an on-site provider. They would be seen by their emergency room physician who might recognize that they need a psychiatric evaluation. The next step would be actually seeing the patient through audio-video connection. And then we would talk to the emergency room physician, making sure that all the care questions are addressed and that we made the appropriate recommendations for the next level of care for that individual.
What made this experience so different the next time was that we were seen while my son was still in the mental state that caused us to bring him into that hospital. I can say without a doubt in my mind, with 100% certainty, that the fact he was seen in a timely manner made a huge positive impact in getting him the care that he needed.